Welcome to UITM Clinical Skills Program. This is Clinical Station 5, Venepuncture. In this video, you will learn the correct technique of performing a venepuncture, usually performed for the purpose of drawing a blood specimen. Before beginning, make sure that you have prepared all the equipment required, including the alcohol swab, syringe with appropriately sized needle, tourniquet, cotton swabs and specimen container. Please ensure that your hands are washed and gloved as well. Position the patient's arm in a comfortable extended position that provides adequate exposure of the planned area for venepuncture. Inspect the arm for a suitable vein. It should ideally be visible without applying the tourniquet. Apply the tourniquet approximately 4 to 5 finger widths above the planned puncture site. Palpate the vein that you have identified. It should be filled up and easily felt. Clean the site with an alcohol swab and allow it to dry. Do not touch the cleaned site afterwards before pricking the vein, otherwise the cleaning procedure will need to be repeated. Insert the needle directly above the vein, through the skin, at an angle of 10 to 30 degrees with the bevel facing upwards. Observe for flashback of blood in the needle hub as you advance the needle. Once you see the flashback, stop and hold your syringe and needle steadily in that position. Then, carefully withdraw the plunger of the syringe to aspirate the blood out. Once you have obtained the amount of blood sample that you require, apply pressure to the insertion site with a cotton swab and gently withdraw your needle. Remember to release the tourniquet. Put the used needle and syringe safely aside and continue to apply pressure on the puncture site. Replace with a plaster once there is no longer active bleeding. Transfer the blood specimen from the syringe into the correct containers, making sure that they have been labeled with the correct patient details. At the end of the procedure, dispose of any used items, including any clinical waste, into the appropriate bin and wash your hands. To supplement your learning, please go to our CSL platform to download materials related to this station. You are also encouraged to view this video again in our CSL platform to help you with your practice sessions.